So this is the Alaris pump. This is the pump that you'll see being used at Children's when you have to give maintenance IV fluids or any volume of medication that is over 60 milliliters or 60 cc's. Okay, so to start off with, this Alaris pump, this portion of the pump is called the brain. Okay, and then you have chambers. Right now we have 2 chambers on there. I'm going to show you how to remove the chambers. And this Alaris pump can take up to 4 chambers. Okay, so that means you can have 4 items going at the same time that have a volume of over 60 cc's going. So what you want to do to remove a chamber is you're going to press this blue tab here, and it just comes off pretty easily. Okay, and then to place it on, you have to do it kind of like at a 45-degree angle, which I think I have. Okay, and then you're going to, you need to hear that clicking sound. Okay, hold on. 45-degree angle. Hold on a second. Okay. Wait a minute. These have been used and abused, but okay. There we go. There's the clicking sound. Okay. And if you don't hear that clicking sound, it's probably not on there correctly. But the other thing too is this is considered a smart pump. So once you turn it on, it senses how many chambers are on there. So if your chamber is not on there correctly, it will not sense it. So if you know you have 2 chambers or 1 chamber and it's not sensing it, then that's probably the issue. Okay? So the first thing you want to do is you want to turn on the pump, press the system on button. It's going to go through its checks. Okay, so normally it will default to a new patient, and this is what I wanted to do. But if you have a patient that has been here, it probably will keep the patient's information in. But for teaching purposes, this is a new patient. The pump will alarm like this, so just silence each time. Okay, so this is a new patient, and we're going to press yes. So the cool thing about this is that you need to program the pump according to the patient's weight as well as where you're located in the hospital. Okay, so general peds 2 to 10 kilos. That if your patient is anywhere between that and you're on a gen peds floor, okay, then that's what you would press. But because I want to teach you just the different, the different profiles they have, I'm going to go ahead and say no so you can see the different profiles they have. So you have, if you're on an ICU setting, which you won't be, these are some of the profiles that you can have, and they're according to weight. If you press the page down, you can be on a HEMOC floor or a Gen Peds floor. But we're going to say we're on a Gen Peds floor, and my patient weighs between 10 to 40 kilos. I'm going to confirm that. So you see the A and the B? These are the chambers that it senses. Here's the A chamber, and here's the B chamber. Okay, so it's on there securely. The pump has sensed that it has 2 chambers on it. So what I'm going to do now is I am going to actually show you the type of tubing that is used for this pump. So this is the Alaris tubing, and it's actually comes, when you get it, it'll be in a package, and there'll be a blue plastic protector over here. But this is the type of tubing that you use. And you do have to prime it manually before it goes on the pump, so that's what I'm going to do. Okay. So there are some clamps here. I'm going to clamp it right now. And I am going to actually prime it. There's air in here, so I'm going to prime it. I have it clamped down here. No. Where is it clamped? Okay, it's coming very slowly. Okay, there it goes. These are old tubings. It doesn't necessarily happen like this when you get a new one. I'm just trying to get the air out of this one. Because if you don't do it, this pump will sense that there's air. There are sensors in the pump, so we want to make sure that we get the air out and it doesn't start beeping. Okay, I think I can get away with this. Let's see. Okay, so we're going to place it in chamber A. To open this chamber, there's a lever right here that you open. And there really is only one way to put this. It will not function if you do it any other way. So this had a blue sheath over it. It's not here anymore. This is the portion that needs to go into the chamber. So this blue area sits right here. This portion of the tubing goes right into this portion right here. I'm going to silence. And you want to make sure that everything is nice and snugged in there. Okay? And I'm going to close the door. And that's what it was alarming for, because the door was open. So now I'm going to say that I want to use chamber A. Now, students are usually tempted to touch the screen. It is not a touch screen, so you do need to press the actual chamber, channel select. Okay, so if you notice, there are guardrails, and then there's basic infusion. So you're going to be working on a PEDS unit in a PEDS hospital. You need to use the guardrails for drugs or IV fluids. So I have IV fluids going here. This is going to be, let's say this is D5W. I'm going to press guardrails for IV fluids. If you notice, there's a number of selections that come up, and they are in alphabetical order, but I don't see D5W. So I am going to press A through E to look for that. And I see D5 and a half, D5 and a fourth. I'm going to go down some, and here's my D5W. So I'm going to press that. And it will ask me if that's what I want to do, and I'm going to say yes. And it wants a rate, so that's usually given to you. So this patient weighs, let's say this patient weighs 15 kilos. Okay, so we want to give this patient 40 cc's an hour. At Children's, if the patient has a central line or if the patient has an IV, there you do need to set the pump at per policy at the correct frequency. So if the patient has a PIV, you can actually set your pump to run for 2 hours. I'm sorry, for a PIV, run for 1 hour. And the reason being is that what this it will do, it will alarm at 1 hour, and it will prompt you to look at the patient's IV site. Okay, so when they have a PIV, you need to be looking at their site every hour to make sure that it is still going well, that it's not infiltrated or anything like that. If they had a central line or a PIC line, you can actually have this pump run. Hold on, sorry. You can actually have it run for 2 hours. And per policy, every 2 hours, you should be checking your patient's site if they have a PIC line or a central line. Okay, so we're going to say that this patient has a PIC line, and then we're going to press start. And so it will infuse. This green button, this green light shows that everything's okay. You see across this chamber here, there's a label that says D5W, and that tells me that I have D5W going. That's the correct solution, and it's going at a rate of 40 cc's. Now, I'm going to purposely clamp this just to show you that it's going to say occluded. And notice that this light will change and then the pressure will go up on the screen. Notice that the pressure is rising. It's rising. It's rising. Okay, it's saying checking line, it's saying yellow, it's yellow now, and it's going to beep very soon. Okay, so it says occluded patient side, and you see the red button. So that should tell you I need to look below this chamber because maybe the patient has kinked the tubing or wherever it's located on the patient. Maybe the patient has bent the arm or the wrist or whatever. So it tells me that I need to check downstream. Okay, so if I had tried to occlude it from the top, well, let me start this over. So if I purposely do something to the top, okay, so it says occluded fluid side. So that's anywhere above there's some type of occlusion. And in this case, I'm stopping the fluid from going through the chamber, okay? So we silence, we troubleshoot what the issue is, and then we restart. The other thing I want to show you about this, let's press channel select. Remember I told you my patient was 15 kilos? The way that the guardrails work, I'm going to pause this, is that it gives you some safety alarms if you are giving too much volume to a patient who weighs 15 kilos. So let's just say that the physician ordered for this 15 kilo child something to run at 250 cc's an hour. What this pump will do, it will, 15, well, actually 15. I need to do something crazy. Okay, hold on. Pause. 15, something insane for this patient's weight would be maybe 600 cc's. Pause.
That doesn't seem right.
Yeah, that doesn't. Hold on, pause.
It'd be good like dopamine or something. I don't know.
Oh, you know why? It's because it's fluids, but still, because you could give a bolus to a child that weight. I'm gonna go under medications. I apologize. So let's pretend. Let's go ahead and channel select. I'm gonna change the profile because this is a fluid. You can give a fluid bolus to a child that quickly.
Really needed it.
Yes. So that's why it didn't alarm. But we are going to pretend we're giving a medication, and we'll see what happens. Okay. So let's turn this on. And let's say new patient, yes. And let's say that our patient is actually, I want to make this patient 2 to 10 kilos. Confirm. And I am going to be giving a medication. So I go into guardrail drugs. And you see, again, it's in alphabetical order. Let's just say that I am going to be giving let's give some claflin. Hold on, let me find it. No, let's get some Cipro. Let's get some Cipro. Okay, so let's press Cipro. And we want to, yes, it's confirming the Cipro is in milligrams per milliliter. I'm going to say yes, and it is. And we want to give to this patient who's only 2 kilos, we want to give something like 300 milligrams in, let's say, 60. And the patient is the pump is asking you, how much does this patient weigh? I'm going to say 2 kilos. So, next. It tells you the dose exceeds guardrail's hard limit for patient, for 40 milligrams per kilo. So this, what it's telling you is this patient's weight, this amount of the drug is way too much. So what you would do in this case, obviously double check what you put in. And if that's the case, you want to go ahead and question the physician and let them know that, are you sure this is how much you want to give? You also want to contact your pharmacist and find out, is this the amount that we really want to give this child? If it is, then you need to chart, your nurse or you need to chart that, yes, this is the correct dose, and then you can override. You could actually, for this, you won't be able to override. Actually, you will not be able to. You have to reprogram it. You cannot give this amount to a patient. So in that case, it would be something where you'd be doing a basic infusion. But like I said, it's a smart it's a smart machine, so it tells you that this is way too dangerous for a child that size. The other thing that I want to show you is that if you're giving blood, let's go to the drug library. That would be pets. Oh, yeah. Okay, so I've got to come off, yeah. There is an option to, if you're giving blood, to use volume duration. So that's what I want to do. New patient, I'm going to say no. So this patient is 2 to 10 kilos, yes. A is the channel, and then I want to give blood, so I'm going to press blood, and yes, this is correct for this patient. It gives you, again, some advisory, some advice regarding giving blood, okay? So you want to confirm that. So nothing should be given at the same time when you're giving blood through the line. So the rate, I'm going to say, this is usually given to you by the physician. Well, not the rate, but they'll tell you the volume that you need to give. So let's say they want to give this patient 80 cc's of blood. That's how the doctor will order it, and they want you to give it over 4 hours. So you have to calculate what the rate would be. So what you would do, if you're not good in math, and what you should practice doing is, hold on. I want to give 80 cc's over 4 hours. So the volume duration is 4 hours. And the volume to be infused, this was a doctor's order, 80. So the pump will program it to go at 20 cc's an hour. Okay, so that's something that's done when you're giving blood or albumin or those kind of products, okay? And then you can press start if everything is okay. I want to show you something. Sometimes we have parents and patients who have been here a while. They're sick of hearing the alarm go off, and so they can manipulate this pump. And I want to show you how to lock the screen. So as you're talking to the patient, just want to show you this first. Behind here, oh, that's pretty. Oh, that looks pretty there. There is a this black knob here. If you press it for 2 to 3 seconds, it will it will lock the panel, okay? So what I'm gonna be doing, and you have to do this discreetly, obviously, okay? So as you're talking to the parent, you wanna go ahead, and I want you to pay attention to what happens to the screen. It will lock the screen. I'm pressing it and talking, and did you see? Panel locked. Okay, so now, whenever something happens, there's nothing that can be done until the panel is unlocked, okay? And only you will know that. So I'm gonna unlock the panel, and watch, it says panel unlocked. Okay, so now you can manipulate and do all that you need to do, okay? So these are, the other thing I wanna show you is the KVO rate. Okay, so let me do that. What happens is this pump, when it gets to the last amount, it will keep the vein open at a rate of like less than 1 cc's an hour, so that the line doesn't occlude. So I'll show you what that looks like. So if you can't get to the patient quick enough, know that this alarm will go off, and it will allow the vein to stay open until you can come and address it.
It's going really slow.
Okay, I know what I'm gonna do to make this quicker. Okay.
Time left, less than a minute.
And then you'll notice on the channel label that it says infusion complete KVO, okay? So those are the different alarms that you will hear. And then again, you'll just silence, and then you'll address the issue. What you can do, if you want to, let's say you want to, if it's something you're giving that you want to continue giving it, you just checked your site and everything is okay, you have an option to restore. That option, restore, you press that, and it'll go back to the same volume that needs to be given and at the rate. So this will be for maintenance IV fluids that you're giving, and you want to check your site every hour or every 2 hours, and it's the same patient, and you just want to go ahead and check that and then restore your volume, okay? All righty. Thank you.